Hello, I'm Ralph Stevens. Thank you for investing in this video training program to learn more skills to help more people. It is my privilege to share with you this exciting information that can help many people who suffer from shoulder pain and injuries. The purpose of this video is to share with you a very efficient medical massage routine done on a massage table that thoroughly examines and effectively treats every muscle attaching to the scapula, except one, well, actually except 1.5. So now it's time to let the demonstration begin. It's under the pectoralis major muscle, which we've just examined and softened up and loosened and lengthened. So now we're going to come up under that muscle, flex our fingers onto the ribs, and drag lateral in a friction stroke across the pectoralis minor. Now, to do this, we have to come in posterior to the breast tissue and the pectoralis major and press straight in till we just touch the ribs. And then move our fingertips superior and, anterior and medial up under the breast and the pec major, and then flex our fingers down onto the ribs and drag lateral. And as you drag lateral, you'll feel you fall off of a layer of tissue. How's that, Linda?
Fine.
It's fine. Okay, we have a healthy pec minor here. Now, these can be excruciatingly tender. And sometimes we have to ask, can I do 3 strokes in 3 places? And most people can handle that. You can kind of see as I'm coming down here, I kind of flip off of the edge of it here. If you don't feel that you're on a layer and that you drop off of it, then you're probably not medial enough. Continue working medial and superior to treat the muscle as far superior as you can get. Try not to come off the edge and then press deep into the tissue, because you don't want to risk getting into the brachial plexus, which passes under the pectoralis minor muscle. So just as soon as you reach that edge, just barely drop off of it and stop. Now, we can also examine with a little bit of, with the fiber friction, sliding up this muscle to elongate it, and we can work cross fiber on the muscle. And we've thoroughly examined Linda's pec minor, and it's okay. She's not making faces at us. Again, this is often very tender on people, especially that have an internally rotated posture. This is also a big player in the brachial plexus entrapment syndrome, entrapping the brachial plexus as they come down the arm and leading to that thoracic outlet syndrome or brachial plexus entrapment. And so pec minor is a very, very important muscle for you to learn how to work and how to work it gently. When you first start working this muscle, you're going to be probably pressing too hard, trying to find it, trying to perceive it. And so that's just going to take some practice, but develop some finesse, and you can actually coming in under and lifting up under this tissue is not painful to the patient at all, even when their pec minor is very unhealthy. And you can get up under. It's when you flex down onto the muscle. And so you can control how hard you flex down and work slowly, and you can treat a very, very tender pec minor. And this pec minor will respond very rapidly to treatment. Give it about 3 strokes in 3 places and move on with your routine like we're going to do, but then come back and treat it a second time and give it a few minutes and come back and treat it a third time. That's probably enough for 1 day. And then each time you work the patient, you'll begin to make great progress. With her palm up. Now, the reason I'm doing that is I have to expose the cuff to treat it. If I have her in this position, supraspinatus is going to go up under the acromion process and I won't get very much of it. If I put her palm down, it rolls her humerus so that the infraspinatus tendon is not very available. So we want the arm at the side, palm up. Now here's a very easy way to find the rotator cuff tendons. If you find the V of the acromioclavicular joint where we began our treatment of the supraspinatus muscle, place your finger lightly in that V and slide straight lateral. You'll come out to the edge of the acromion process, and then you'll drop down onto the head of the humerus. And right there on the head of the humerus, if you cross fiber friction anterior posterior, you'll feel a gristly little area underneath the deltoid, and that's the supraspinatus tendon. Now if I move about a thumb width around to a 45-degree angle relative to her shoulder and cross fiber friction here, I'm up against the acromion process on the medial side of my finger here and pressing down onto the head of the humerus. This will be the infraspinatus tendon. And if I move about another thumb width down, that will put me right on the posterior aspect of the humerus, and that is the teres minor tendon. So straight from above is supraspinatus, at a 45-degree angle is infraspinatus, and straight from behind is teres minor. Those are the three rotator cuff tendons. And you want to give this area a good dose of circular or cross fiber friction or multi-directional friction, but really get in and mobilize that tissue, and that will help prevent the adhesions and the buildup of disorganized scar tissue in here that can lead to problems in the rotator cuff. This also helps to heal minor rotator cuff injuries. If it's a severe injury, high level 2 or a level 3 tear with most of the fibers ruptured or all the fibers ruptured, then it's too late for this. But then once it's been repaired, or if it's a level 1 or a low level 2, we can really do a lot for this rotator cuff. Plus, just keeping this rotator cuff in good condition will help prevent the injuries. Also, I will do a palmar type of friction or superficial friction to just generate some heat in the cuff. Linda, tell me when that's starting to get nice and warm. Getting warm, yeah. And that can feel very good for this area too, assuming, of course, that it's not inflamed. And you can see it's nice and pink now. So that's our treatment of the rotator cuff.